You are watching the Doctalk show.
Okay, thank you, Darius. There are designated areas where these patients can get accommodated. For example, in Mulago, there is a hostel that patients can be accommodated while they receive treatment. Sometimes patients come from very far, and then you find that they have to receive maybe radiation for about 5 weeks. So they can't receive treatment while moving back to their homes. So these patients then are accommodated in that hostel, which is encased within the hospital premises.
Okay.
And to add on to that, with these palliative care patients, what they need most is talking. The healthcare workers invest a lot of time in talking to them to be able to understand their problem. Because without communicating, at times you may not understand exactly what the patient is going through, but when you give a patient time, then you get to know even their inner problems. And it's from that discussion, that talking, that problems are identified and then they are addressed appropriately. As you heard Dr. Jack say, palliative care is teamwork. Everybody has a role to play. The social workers have a role to play. The spiritual workers have a role to play. The relatives are the main carers. They have a big role to play, especially when they are supported. Because if they are not supported, they get that burnout and they may abandon the patient. So volunteers play a very big role, and they are trained to be able to support all these the patients even at home. And I think that's where palliative care really is a little bit different from the medicine that we know. Exactly.
We have had in the past patients diagnosed with HIV, for example, and we know that antiretroviral therapy helps these patients. And some patients, because of the psychological distress, they refuse to take the medicines. And we've managed some of them to help them get back to track and take their medications and get better. We have also had patients who have had severe pain episodes because of different infections that come in the setting of HIV. And so they grapple with the pain. We come in, manage their pain better, they improve, and then they continue with their normal life. And this is why I say palliative care is more than managing patients who are terminally ill.
Terminal illness.
The talking plays a very big role. You know, in the community, you will hear patients saying or relatives saying, they sent us away from the hospital. They usually say that because they've not understood why they were asked to go back home. But with palliative care, we work with the patient at every stage, explain to the patient, explain to the family members so that they are in the know of what is happening, and actually they do appreciate the entire process. As healthcare workers, especially in the health facilities, we have a fear of breaking bad news, and that causes a lot of distress to the family, to the patient, because there is that conspiracy of silence. The relatives know.
Don't want
Yes,
to tell the patient
the bad news.
bad news.
And instead of telling the patient, we run very fast and tell the carers. And the carers say, please don't tell my father, please don't tell my dad. But remember, that patient's body is telling him. Whether you hide away information from him or not, the body is telling him. For you as a healthcare worker to go and say, you're getting better, and then tomorrow I see myself not getting out of bed, then I realize there is something wrong here. And then when we come to hospital and you take away my relatives, you talk to the relatives and you don't talk to me, definitely I realize that there is something wrong. And that impacts on my psychological feelings. And that can make the patient's condition even worse.
How do you address this problem of morphine, prescription of morphine? Don't some patients become addicted to it?
Thank you, Darius.
Or they may exploit palliative medicine and start getting morphine.
Yeah, I think that is a a strong myth, even among not only the community, but also among some health workers. Our experience actually is that morphine is one of the strongest painkillers that we have ever. And the clinicians who take care of patients with pain should be trained in how to use this medication. That is the starting point. So there is training that has to be done so that they safely but appropriately prescribe these medicines. We know that patients will benefit from these drugs if we use them appropriately. Usually we start these patients on very small doses based on what their pain scores rate. And then we titrate the medication accordingly. The side effects are always there like any other medication. Some patients will get a bit nauseated, some patients might vomit. Constipation is an issue that comes up, but these side effects can be managed and they are not as horrible as the pain that the patients have. So I think my advice to the public is that you need to see a clinician who can appropriately and safely prescribe the strong medicine, and if it's used appropriately, then it will help and not cause a lot of problems.
And as elaborated palliative medicine, the healthcare workers are trained to prescribe it correctly and appropriately.
Yes.
So there's no room that something will be misused or abused.
Absolutely.
Okay. So what are your final words to tell the public about palliative care?
I'd like to tell the public that patients who are in a lot of pain should not be left to suffer pain. Pain is the worst enemy of man. We should help the patients to access these medicines. The medicines are available. The government of Uganda has actually purchased these medicines which are adequate for patients not to suffer pain. It is illegal to leave a patient in pain. Therefore, let us help the patients to access palliative care services. Let us help the patients to have their pain controlled so that they can have good quality of life.
Okay, so pain control is your focus. Patients who have terminal illnesses shouldn't be left to suffer in pain. And you correctly mentioned it's not just physical pain, other types of pain, emotional, social, spiritual pain can all be addressed by palliative care medicine. So Dr. Jack, how would you, any final words for the public?
Yeah, as clinicians in medicine, even based from the principles of medicine, we know that we are trained to cure sometimes, care often, and comfort always. So I think for us in palliative care, we do all of those things. We usually stand with the patient up to the point that they pass on, but also stand with the family during the bereavement period, which I think is a very important aspect for us in palliative care, to deal with the patient and family and have them have a good experience about their loved ones.
Okay, so thank you very much, Dr. Jack and Ms. Rose, for this elaborate discussion on palliative care medicine. You've helped demystify what it means. Most people thought it's about cancer, but you go ahead to tell us, no, it's not just about cancer. It addresses a patient's quality of life, someone who has a life-threatening illness. Usually they are chronic diseases, not just cancer. It can be diabetes, it can be HIV, it can be any, even sickle cell anemia. So all these diseases pose a threat to someone's life, and that's where palliative care comes in to help you realize hope, you and your family, to realize hope, to improve your quality of life, and to remove all pain. So I want to thank you for coming to educate the masses on this very important aspect of palliative care medicine. And so you can subscribe on our social media platforms. You can follow us. That's on Facebook, on Twitter. You can also like our videos on YouTube and share with your colleagues. Thank our guest doctors for coming to studio to talk about this issue, and we'll see you next time.